Well, you had a C-section last time, let's go ahead and mark you down for a C-section this time. It's completely up to you to agree to them or not. Hey y'all, and welcome to episode 2 in my new series of now that you found out you're pregnant, what are your options throughout the pregnancy and on into birth. So this is the series I started not long after I became pregnant with my third baby, just to kind of bring some awareness to some of the topics that aren't so much talked about in the birth and pregnancy realm of today's society. So I hope you find these helpful. So the first video focused a lot on right when you find out you're pregnant, as well as mostly through the first trimester. This episode is going to focus on more or less the end of the first trimester into the second trimester. And I am 17 weeks pregnant right now, so right in the middle. And these are just some things that I have kind of made my choices on. I'm going to keep this as unopinionated as possible. I really want this just to be factual information that you guys need. So please share this with all of your friends. I want this to be a very helpful resource for pregnant expecting mamas. So jumping right in, I discussed this on a little bit in the first episode, but that is going to be ultrasounds. If you're kind of following the Western medical culture for pregnancy, you've probably already had an ultrasound early on in the first trimester because they do those to kind of tell your estimated due date. But if you did opt out for that one and you're waiting to do the one in the second trimester because they told you that it is required to have the 20-week anatomy scan, that is optional. You don't have to agree to any ultrasounds. Most OB clinics are going to want you to do several ultrasounds so they can check up on baby, because they are not as versed in using other methods of hearing heartbeat and belly mapping to kind of detect baby's positioning. But if you are not comfortable with ultrasounds and have done a little bit of research into ultrasound technology, you don't have to agree to those. So a little bit of the research I have done shows that routine ultrasounds in a non-high risk pregnancy really have no clear, definite improvement of outcomes, and many times 40% of abnormalities in the pregnancy are not even detected on ultrasound. And oftentimes the ultrasound can detect false positives in certain abnormalities, I cannot say that word today, and actually give parents a lot of apprehension over what is happening to their baby, when in all actuality that ultrasound was actually false and there's absolutely nothing wrong with our baby. I will share a small personal story here in this part. I don't want to get really personal in these videos, but in our first pregnancy we had lots of ultrasounds. At one point they detected that our child was intrauterine growth restricted, which means the baby's not growing. There could be issues with your placenta, your core, baby's not getting nutrients, and it was a really big scare. We went to about 3 or 4 extra ultrasounds just for them to keep verifying that baby was okay, when in all actuality our child was perfectly fine. This was an abnormality that the ultrasound was picking up on his measurements, when ultrasounds can actually be off by several pounds on weight for a baby, as well as head measurements, length measurements. They're just not as accurate as we have been led to believe that they are. The central nervous system is especially susceptible to ultrasound heat, especially in those early first trimester days. So again, do your own research here, but I just wanted you to remember that ultrasounds are completely optional at any point in your pregnancy. I can see why there would be a need for them if there were complications arise and there was truly a need for an ultrasound, but routine ultrasounds are not necessary, and that is completely up to you to agree to them or not. The second option I want to talk about in this video is C-sections. If you have had a C-section in the past, your provider, if you're going to a typical OB, is probably going to suggest that you have a second C-section or a third C-section, whatever pregnancy you're on. And when all actuality, it is actually not necessarily best for you to have a subsequent C-section over and over and over. That is cuts in our body. That is a major surgery. And if we can avoid that and be proactive and prepare our bodies to have a vaginal birth after a C-section, it is totally doable. There are many, many women who have VBACs, which that is vaginal birth after cesarean, that have very successful vaginal births, very beautiful vaginal births. There's even many that have them at home. I haven't actually been in that situation, but I've read many stories of women who have and have had beautiful success stories, even women that have had 3 or 4 cesarean sections and then go on to have a vaginal birth after that. It is possible. There's lots and lots of research out there. You just need to be very proactive in doing the research, preparing your body for optimal positioning. A lot of times, not necessarily, but many times C-sections are performed when babies are breech or transverse, which means they're lying sideways. A lot of times women are told they need to have a C-section when baby could have easily been maneuvered by certain exercises done by the mother that could have prevented that C-section and then subsequent C-sections after that. So if you're being proactive and wanting that VBAC after having cesarean section in the past, it is definitely possible. Find a provider that is on board with that, and if you can't find one that is on board, change providers. I mentioned that in the last video. You are not married to your OB, your provider during your pregnancy. You can leave and fire them and choose another one at any time. So VBACs are a big thing now. I think a lot more providers are more comfortable with doing VBACs now. In the past, I think it was much more feared because after the uterus, that muscle had been cut for a previous delivery, there was always fear that it was going to rupture in the next delivery if you were having contractions in that vaginal birth, and possibly could cause rupture of the uterus and very serious damage there. So I understand the reason for concern there, but many times we doubt our bodies and how capable they are of healing themselves and doing what they were supposed to do even after a surgery, a major surgery such as a cesarean section. So do your research on cesarean sections, VBACs after that. Like I said, I'm not an expert on this. I've done a little research on it, but I'll leave some resources below, some really good books that talk about vaginal birth after cesarean if you are in that situation and really wanting that vaginal birth after your previous C-section. You don't have to go in at the beginning of pregnancy and your provider be like, oh, well, you had a C-section last time. Let's go ahead and mark you down for a C-section this time. I've got you on my books. Write it on your calendar. Here's when we're going to have your baby. That is more or less just very convenient for them. They know when they're going to be coming in. They know they're going to be in the hospital. They know that they're going to be in and out within a time frame of 10 to 20 minutes. I don't even know how long the C-section takes. I know it's really fast. They know they're going to be getting paid more. Insurance companies pay more for C-section, have to pay more for C-sections. So more or less, it's a convenience thing for them, and if your doctor is not okay with that, change your doctor immediately. Moving right into the third one, that is going to be the option of movement during pregnancy. So this one kind of sounds silly because, of course, we all want to move and have the option to move our bodies, but many times we kind of use pregnancy as an excuse to get lazy. I am culprit of this myself many times. I just would rather relax and not get movement in for the day, but that is our choice. We should be honoring our body in pregnancy by moving our body in some way. So I just want to give you some options for movement during pregnancy that can really be proactive throughout your pregnancy and into your birth and labor and delivery. First of all, if you've been doing some sort of exercise routine, movement routine before pregnancy, more than likely it is safe to continue on into pregnancy. If your body is already used to that movement, continue it through pregnancy. Maybe make some adaptations when you start to grow, or not always listen to your body. It is going to be the best indicator of what it is feeling right and what is not feeling right. So listen to your body as you're doing movements. So there are certain things, stretches, exercises, movements that are going to be optimal to get baby into proper position even early on. We want to be as proactive as possible during pregnancy to get our babies in the proper birth position early on, because if we are out of balance, if there is more room on this side of our body than this side, a baby is going to gravitate to where there is most room. So that could be muscles that are not balanced. This is where chiropractic care also comes in, kind of helping balance out the body. Certain stretches, routines, exercises, yoga. The one that I absolutely love and recommend is Spinning Babies. They have a 20-minute yoga routine that I actually start doing very early on in pregnancy and just get things kind of properly, hopefully adjusted so that baby gets into proper position for birth. So moving your body is definitely a good option to choose during pregnancy. Try to not go for that sit on the couch option. I know that there are days when we just want to sit on the couch, relax, read a book, watch a movie, and are not feeling like movement, but try to get that option of movement in there more than you don't, because your body is really going to thank you throughout the pregnancy and on into the birth. This next one I want to kind of revisit from the last video, and that is going to be our option of prenatals. I touched on this in the last video and kind of feel like I might not have explained it very well. I basically said that you have the option of taking prenatals or not during pregnancy, and I do mean that, but I also don't mean that. You definitely have the option. Do you want to take the prenatal or do you want to go another route? But I wasn't meaning like don't take a prenatal and don't do any supplementation at all. I never provide medical advice on here. I just kind of share what I'm doing. So there's definitely a need for additional supplementation in pregnancy. You can get a lot of that from your food if you're eating a very nutritious, mineral-rich diet, grass-fed meats, high-quality animal products, raw dairy, raw cheese, bee pollen, honey. I talk much more about some of my pregnancy foods in other videos, but you can get a lot of your supplementation that you need for pregnancy from food. But there is definitely a need for some form of supplementation. I just meant that if you have done research on prenatals and you are not really comfortable with the ingredients in the prenatals or the ratios of the minerals and the nutrients in the prenatal, you can go another route. And I actually just filmed a video that came out probably prior to this one about the entire supplementation regimen I'm taking this pregnancy instead of a prenatal. So all of those things that you check off with the prenatal, I am getting in another form through either food sources or supplementation. So I did want to clarify that again in this video. It's not like a don't do prenatals at all, just completely skip that step, but research it and find other options for prenatals if you have researched prenatals and are not comfortable with them, kind of like the situation I'm in. But again, check out that video if you want some more information on my exact prenatal regimen, not including an actual prenatal. Next, I want to mention chiropractic care. So this is definitely an option many women may not actually think of during pregnancy. Many women may not have ever seen a chiropractor. I was actually one of those myself. I did not start seeing a chiropractor until this pregnancy. I was 6 weeks when I started going, and I've absolutely loved getting adjusted every week. There are so many changes that happen during pregnancy that chiropractic care is just absolutely amazing for keeping our bodies adjusted to adapt and to grow that baby. Again, helping baby get into optimal birth position, keeping things aligned. When things are out of line in our hips and our pelvis, it will kind of tilt baby to one side or the other. So if we can be proactive and take that option of getting chiropractic care, we're going to be much more set up for success for a smoother labor and delivery. Not saying it's perfect 100% of the time, but it definitely helps. I know many times insurances don't cover chiropractic care, and that's kind of a concern for some women when they are in the pregnancy time. They don't have that in their budget, and I totally understand. I did not have that in my budget. My previous 2 pregnancies and my insurance did not cover it. So that's just another option I want to remind you of. If you have room in your budget or your insurance does happen to cover chiropractic care during the prenatal time, definitely choose that option. Our chiropractor is about 40 minutes away, but I just make that sacrifice once a week and go to visit her. I would love to go twice a week, but unfortunately that's not in my time constraint with living 40 minutes away from her office. But it has been such a blessing, and I've noticed such a difference in achiness and just overall general mobility during this pregnancy versus my last 2 pregnancies. So I'm very excited to continue that to this pregnancy. So just wanted to mention that it's definitely a good option to look into if you are pregnant. And lastly, this is going to lead you pretty much to the end of the 2nd trimester. This is going to be the glucose test. So this is a test that providers do to test for gestational diabetes, something that many women just happen to develop during pregnancy. Nonetheless, this is a in-office test that most providers want to do around 24 to 28 weeks. But you do have options for how you take this test. You could probably definitely opt out, but this is not something I've really researched much. Most providers want you to test for this because if you do have gestational diabetes, there are things you need to be proactive about throughout the pregnancy to keep baby safe. So there are 3 options basically that I have researched. There's a glucola drink that many providers in an OB office will provide with you. There is the fresh test, and then there is a glucose finger prick test that you can do at home. So let me go through each of those real quick, kind of just give you some information about them and then kind of let you choose what you would do. I'll tell you what I do personally and you kind of go from there. So first of all, the most common one is the glucola drinks. This is a drink about the size of a small soda. It's going to be either red, orange, or yellow, I believe. It's been 3 years since I took one. I did do this in my first pregnancy. I did not know there were other options. I wish I had, but I did take it on my first pregnancy. Read the ingredients on the back and was basically astounded that I was putting this into my body. We are very proactive about what we put into our body. So if you're kind of on the same lines, this may be something you want to look into opting out of. So let me just read you a quick ingredient label of what's in most glucola drinks. Glucose from corn, which is a non-GMO crop, citric acid, natural flavors, modified food starch, soybean oil, which is actually banned in Europe, Japan, and India. That is a very highly oxidized PUFA, but in the United States, for some reason, it's safe to put in a drink that you give to pregnant women. Food dyes and coloring, mainly yellow number 6, depending on which color you get. If you get the red drink, it's probably like the red dye number 4. I don't know all this dyes. That is option number 1. You'll drink the drink an hour before going in for your test. You'll get a finger prick. They'll test your glucose levels. If you're out of the range they want, you'll have to repeat the process, wait for 3 hours. It's a very long in-office process, and I just, now knowing more that I have options, would not feel comfortable drinking that drink, knowing what's in it and how I what I put into my body on a normal daily basis. So make that option for yourself if you're comfortable drinking that during pregnancy. The second option is the fresh test. So this is something that my midwife actually offered to me in my last pregnancy. This is very similar to the glucola drink. However, it is a powdered form of glucose. It's just strictly glucose, like a form of sugar. So you would mix it in a little bit of water, drink it, and then she would do the same office finger prick blood test type deal as an OB clinic would do, but it's a much less toxic form of substance you're intaking than that sugary, toxic, dye-filled glucola drink. Third option is the at-home finger test. This is what diabetics would do on a normal daily basis. They would check their blood sugar levels upon waking, and then around an hour after each meal, eating their normal diet. They're not going to change anything. And this is actually the option I took in my last pregnancy and will be taking again in this pregnancy. So it's a little less convenient because for about a week to a 2-week time span, I'm having to prick my finger, check my numbers, write this down, and it's a little bit inconvenient, but it seems more of a whole glimpse of how my blood sugar is balancing itself out, how it's handling the foods I'm eating for an entire week to 2 weeks. This, to me, is just a more overall view of how things are working than just that 1 hour, one test. Although I would definitely be okay with taking the fresh test that my midwife offers in her office, the glucose powder drink versus the glucola in an OB office. So many women have no idea they have options for this. Now, when I was with an OB, I never actually asked if I had other options. This was just offered to me for my glucose test, the glucola drink. I took it, I drank it, I took the test. Did not feel comfortable drinking it and would definitely not drink it here in the future. So you'll definitely have to talk with your OB provider on what options they have other than the glucola, if you can do finger pricks at home, or if you can do something like the fresh test that my midwife offers. So I just wanted you to know there are options there. You don't have to drink a drink that you're not comfortable with during pregnancy. If it's something you wouldn't drink when you're not pregnant, definitely don't advise drinking it when you're pregnant. So those are a few options I want to touch on in this episode, mainly ones that you'll be faced with in the second trimester, just to kind of get you thinking, brainstorming, what would you like to do? What do you feel most comfortable with in your pregnancy? This is your body, your time, your baby. Do what you're comfortable with. You don't have to agree and go along with what anybody says. And if your provider is not agreeing with you, like I said in the first episode, fire them and find one that does. You want to be on the same page, on the same job as your provider, because they are going to be bringing your baby, helping you bring your baby into this world. I always say that they're bringing your baby. You're bringing your baby into this world. They are just assisting you and are there for support and motivation and in case there is an emergency. So nonetheless, you have options. I want you to know your options. If you have any questions or any further topics you want me to touch on in future videos, leave them in the comments below or send me a direct message on Instagram. I would love to know what you guys want to hear about for options in pregnancy. And if you have any questions about any of this, let me know of that as well. Wish you all the best in your pregnancy, and I thank y'all so much for watching, and I'll see y'all in a future video.